I happened to just ask her, do you have any heart conditions? Because I know citalopram can affect your QT interval. I tend to summarize a lot. Taking out over summarizing kind of help to cut down a few minutes. Empathy is very important when you're talking about for the mental health, being very empathetic.
My guest today is Dr. Ufuoma Akpan-Ntem. She passed her MRCGP RCA exam with a score of 161. If you want to learn how Dr. Ufuoma passed her exam, this is a video you don't want to miss. Hi Dr. Ufuoma, how are you doing?
Very fine, Erwin. How are you doing?
Congratulations on passing the RCA and CCT. How does it feel?
Oh my God, I'm ecstatic. It feels like a relief, like, oh my God, like that's how I feel.
It wasn't too long until we had a chat and you were telling me that you're planning to go to Canada and now you've already made it to Canada. So tell me how things are in Canada right now.
I would say good. Enjoying the weather, first of all. We're having good weather. I'm in Calgary, Alberta at the moment. That's where I am. And they're really looking for family physicians now. So in terms of that, there's something they call an accelerated pathway for doctors who trained in certain countries. Those countries are called approved jurisdiction countries. So, and the United Kingdom is one of those countries. So I'm actually in the process of getting my practice license. Hopefully I should get it soon and then I can start practicing. So yeah. So other than that, I'm having a great time in Canada.
I'm really glad that you're settling in. Tell us about your preparation with the MRCGP exam.
Well, I did my AKT in October 2022, which was just at the beginning of my ST3 year, because I'm a little bit, I ran a little bit like a delayed start because of COVID. I started in October 2020, so my ST3 was October 2022 at the beginning. Anyway, so I did that, and then after that, I started preparing for the RCA. I'm glad you guys don't have RCA anymore because it was quite an interesting examination in that you'd have to go to work every day and ask yourself, okay, is this the day I'm going to get a good case to record? So basically, I think the way I started was when I finished my AKT exam, I rested for about a week or two, and then I started prepping for the RCA. So started recording about November, but I didn't use any of the videos I recorded in November. November and December basically were just for me to evaluate my consultation styles, see, where I needed to make changes. And fortunately, my ES was quite good with that. So what we used to do was record the videos, look at the videos, and then kind of decide, okay, you need to change this, do this. So that's basically how I started. And fortunately, I also stumbled across Dr. Erwin's YouTube page, and he had a lot of videos about consulting, RCA exams. And one of the things that I really got from watching his videos, or some of the things I got, was one, time management. And then the second one was also being an intentional listener. He has several videos on his YouTube page about intentional listening. So I actually made a playlist at the time with some of the videos from your page, Dr. Erwin, and I, watched them. I made notes. And I think you also have, at the time, you also had some free PDF document. I can't remember what it was. Was it blueprint or something? I can't remember, but I kind of
Print
like
of the case selection.
something like that. So I actually went through that. So that was actually one of the ways that I started, and then I also there was an RCA textbook on Amazon. I forget the name now, and I don't have a copy. And there was also a CSA book as well of cases. I used to take that to work as well, just to quickly check things. And then I also had there's this big RCA CSA book. I think Emily Blount has that. So I used to use that occasionally, but I think I use more of the smaller ones because those ones were handy and easier to kind of go around with. So I did a lot of that, and then videos as well. So yeah, and just basically rewatching myself, and discussing with some of my colleagues. We used to just kind of discuss and kind of see where we went wrong and correct ourselves. So yeah, basically, yeah.
With the preparation, you mentioned that time management was one of the things. So tell me, how did you manage to compress your consultation within 12 minutes, Ufuoma?
um Honestly, it was very hard because, like, especially with the RCA, a lot of patients, would you'd ask them a simple question and they would go on and on about um you know the complaints. And so a lot of times just the patient's introduction would actually make you lose time. But one of the things that I learned in also from your videos as well was don't over summarize. So one of the things that I had to stop, because I tend to summarize a lot. So taking out over summarizing kind of helped to cut down a few minutes as well. And also um you know also, I think one of the other things I did was trying to be more focused in my history. That's a bit difficult sometimes because some patients want to take you all over the place. But I think being, focused in history, knowing what to ask, was also very important in helping me to kind of cut down on my usage of time.
I remember one of the things we had discussion about was how to be more concise, and when you're talking, to say a few words, but then you can convey that message without having to have a long-winded phrase. So tell us then, when it came to the clinical management, what were the things that you were doing in terms of making sure that you had a shared management?
I think one of the main things I always, is very important also when you're doing your history, also asking for the patient's expectations. So I think that's one of the key things, being able to reflect that expectation back into the management. That really helps with, giving a shared management. And also just basically in the beginning of offering the patient management, just basically giving the patients options, and then asking which ones they wanted. And then also, I mean, you're the doctor here. To me, I feel like even though you are doing shared management, also kind of like if you feel like there's the best practice, kind of you can also indicate that these are the options, but this is best practice. It's something you can also kind of add in as well. But always involving the patient and asking the patient, like, what do you think? Are you okay with that? And, so yeah, that was, I think, some of the ways that I did shared management.
How did you develop your own style, Ufuma?
Oh, I think it's just practice and practice and practice, watching the videos, going back, deciding, oh no, take this out, do this, add this, you know, and then just basically, listening to feedback from others as well was very, very crucial as well. And then, yeah, just refining and refining, not being afraid to take correction, and just redoing and redoing, practicing and practicing. I think that was just the way to go.
When it came to the chronic diseases, was there anything that you found useful?
Yeah, of course, definitely. One of the things that I used to do for, I mean, most of the patients for the RSA was basically knowing about reading their past notes, knowing, what medications they're on, what other comorbidities that they had. I think that also helped to save time when, talking to patients with chronic diseases. And I think that's the main thing, I think, for the chronic people with chronic conditions, just basically having an idea about them before starting the history. I mean, it's going to be a bit different now with people that are doing the new exam with the SCA, but I'm assuming they will give you a little bit of a background when they give you your patient notes before you start seeing the patient. So it kind of is similar in that way, just making sure you understand, or have an idea what the patient's background is.
That's a good point. So in the new SE exam, one of the feedback statement is about utilizing the pre-existing information. So this is where the priming is very important, especially when it comes to making sure that you make note of the relevant parts in the case briefing. History taking for mental health case, what were the things that you did differently?
Mental health is a bit of a tough one, but I think because actually I submitted two mental health cases, and I think the most important thing for me was making sure I asked of um, suicidal thoughts. I mean, and also making sure I signposted them and talked about red flags and safety netting. I think that was for me the most important thing, other than the history taking. Empathy is very important when you're talking about for the mental health, being very empathetic.
Are you feeling anxious about the SCA preparation? Maybe you're not getting constructive feedback, you don't know whether you're doing the right thing. If you're looking for one-to-one support, I'd love to help you. Click the link down the description below to book a call with me to see how I can help you to pass your exam.
Also trying to find out the background as well. Background is very important for mental health as well. Was it, for me, finding out, was it like a recent stress, or was there a past history of something happening? And also just depending on the symptoms, could it have been from a medical condition? And also making sure you know the patient's drug history as well, very important for if you're prescribing antidepressants, because actually I was quite one of the mental health cases I had. She had been told about citalopram, and I happened to just ask her, "Do you have any heart conditions?" Because I know citalopram can affect, your QT interval, and she actually said, "Oh yes, she used to have a irregular heart rate or whatever." So I said, "Okay, citalopram, I don't think is going to be the best option." So I know that is it's not always easy to remember, but always remember that as well, for mental health. Yeah, but I think those are the main things really. But empathy is very important. Red flag, safety netting, and also patient options as well. What else would I say? And yeah, just offering counseling and things like that for patients with mental health, and empathy. Also, if the patient is crying, don't forget to offer tissue.
That'll be different for the SCA now. But yeah, definitely empathy is really important. To build rapport with your patient is something that some GP trainees might struggle, especially some people coming from overseas because they not find it natural. What piece of advice would you give to somebody who struggle with empathy?
I think it goes back to intentional listening. Basically, reflecting for me was listening to what the patient has said to you and being able to reflect back to the person. I hear you saying this. I feel that this is what you want, or was there anything else you were kind of hoping? Just even though it's doing it that way, it doesn't look like you are forcing it. So instead of ticking the boxes and checking the boxes, I think for mental health it's just important about doing that. And if you do that, your empathy looks genuine. I think for me that's one of the key things I would say. Even though if you feel that it's difficult for you to do that, just try to listen to the patient, what the patient is saying, because sometimes some patients actually keep repeating some certain things. So just listen for those things that the patient keeps harping on. And if you're able to bring back into your history, your conversation, it shows that you are being empathetic, and also bringing that into your management as well.
When you listen actively, you pick up on these cues. And when you pick up on these cues, then you use that to ask your follow-up question or to tie it with your clinical management. It makes your treatment plan more personalized and the patient feels that they're heard and they're understood. So tell us about the other cases that you selected.
For reproductive health, I submitted a patient with endometriosis. She had pelvic pain with suspected endometriosis. And then I don't know if it will fall under reproductive health, but females, she had postmenopausal bleeding. So those are the two cases I submitted for the female women's health. Then I remember in our conversation before the exam, you had asked me what my strengths were. I told you I'm quite good with skin conditions, dermatology, and also with kids. So I think a few days afterwards, I got a patient I got two patients with skin conditions. One was a chronic condition, so she had a flare up of psoriasis, and that was actually quite a good one. Second one, I also had another dermatological case, and that was acne rosacea, initial diagnosis of acne rosacea. So that was also quite another one. I know I had mentioned it, and when I said it, people were like, "Oh, it looks like a simple case," but at the end of the day, I didn't fail any case in my exam, so I'm assuming that it was accepted. And then I think you mentioned for pediatrics as well. So I submitted a case of constipation in children. And what was the other kid one again I submitted? I think that was that for children. Umbilical hernia in a baby. I submitted that as well.
Right.
So so yeah, so when you had mentioned that to me, then I started looking out for things that I was good at. Unfortunately, with this new exam with the SCA, unfortunately, you won't be able to select what you can submit. So I guess in that regards, RCA had that advantage, but in other ways, it had other many disadvantages in that you were constantly under continuous stress for months on end. So
In terms of your skill set, then after doing the exam, how did you feel then?
after doing the exam, I think going through the process of preparing for the exam actually makes you a better doctor with regards to developing those skills, like I mentioned at the beginning, intentional or active, active listening. It helps you, refine, your management skills, how you speak to the patients, and helps you with your time management as well. So by the time you're done preparing for the exam and you actually go back and start practicing once you're free from exams, you actually find that, oh, okay, wow, I'm a much better doctor than I was before I started preparing for the exam. So I think, yeah, that really, really changed my management or my clinical skills, because at the end, for the last few months of, practicing or working as a trainee, I was doing 10 minutes. It was kind of stressful, but I was able to kind of, not run behind too much, even with the 10 minutes. So
Could you tell us what was your score?
161.
If you had to sit the new SE exam, how would you have prepared, Ufuoma?
I guess it would be the same way, going this time around, practicing with colleagues, for ideal cases, going over each system, possible cases, like any scenario, different scenarios basically, and yeah, basically and then also, being in clinic. Looking back now, I know a lot of people that are doing the SCA might not be inclined to record themselves because their exam does not involve, recording and submitting a recording. But I think if, for example, I had done the RCA and I had failed, God forbid, and I had to do the SCA, I would have still recorded myself once in a while, just because watching yourself, consulting is a very, very good way for you to actually improve your clinical skills, because then you can see your nuances, you can see your habits, the things you do that are not exactly very attractive to other people to watch, or to listen to, maybe things that you keep saying, or different things you keep repeating. And so that's one of the things that I also do in addition as well, to preparing and practicing with colleagues.
Recording is definitely a really good way of preparing. And with regards to confidence, then, how did you build your confidence?
I guess it's fake it till you make it, really. In the beginning, you would kind of act like you're confident, and the more you watch yourself, or the more you feel like um, when you get feedback, you feel like the feedback is improving, or you feel like you're spending less time with the patient, and those things. Or let's say you make a diagnosis and you check and it's correct, and those things help to build your confidence. And the more you do that, it's all, I think clinical skills is just it's just repetition. The more you do that, and your confidence level kind of improves.
It takes practice, repetition, showing yourself that you can do it, and having these small wins is going to help you to build your confidence. So, with regards to the resources you've used, you mentioned about the videos and the help that you got. How did you think about which one you were going to go for? And because there's quite a lot of resources, how did you choose?
It was the ones that appealed to me, the things that I felt were easy or practical. Number one, things that were practical, things that were easy to follow. I'm not someone that I don't enjoy reading epistles and long Anything that, is going to take, if I see something that's going to take, a long time with lots of wordy things, I don't read those kind of things. So basically, that's why I can't remember the books. I don't have a picture. I don't have the books here with me, but there's some RCA and CSA books on Amazon. Simple cases, cough, and that kind of thing. Simple, what to ask. Those are the kind of things that I used to prepare. And yeah, so for me, those things appeal to me, because that's the personality that I have. Yeah, so that's basically how I chose what I went with.
What last piece of advice would you have for somebody who is preparing for the exam? Maybe they didn't pass and they're struggling right now.
Well, sorry that you haven't passed, or if you're struggling, I would say you can do it. Don't be afraid that you're not going to be able to make it. You can make it. I would say reach out for help. Sometimes, you have to look outside yourself. Let somebody else also look in and assess and see, what you might be doing wrong. And don't be afraid to take feedback, and then also to work on it as well. And don't be afraid to also ask other people what, for tips and for help. And don't hesitate to practice with others, because this exam is all about practice and practice and practice. Because especially now that you're doing the SCA, your management skills and your um, you know has to be at the tip of your finger. So if you're not practicing regularly, it'll be difficult for you to, say those things reflexly once you are face to face with the actor on the screen.
When you were preparing for your exam, how did you go about developing these role play simulations and having a group, Ufuoma?
To be honest, I didn't do a lot of role play, for the SCA. I guess because every time you see a patient, I was basically trying to record, and the patients were kind of my role play. And going back to, because I think during the RCA, you were only allowed to discuss with people in your cohort, in your group. So my other colleagues in my year group, we used to watch our videos together. And so by watching those videos and, giving feedback, even sometimes the feedback was difficult to hear, but just being able to humble yourself and listen to the feedback and take the feedback and go back and change. So that was our kind of role play, because, of the situation we were at the time. So yeah, I think it's very crucial to have someone else listen to you and watch you and be willing to just listen and accept the feedback, no matter how painful it is, because you're only going to get better, at the end.
Thank you very much for the advice and sharing your insights and experience today. I'm really glad that you've managed to pass it and now you're a qualified GP. What can we wish you in the future?
I guess, wish me good luck. Starting practicing on my own as a family. In Canada, it's called family physician. As a family physician, yeah, it's daunting starting, at least for the past 3 years, I've been a trainee. I've been relying on, feedback, on, debriefing with, with my supervisor. So yeah, just praying for good luck. And yeah, as I embark on this journey as an independent family physician. So yeah.
Well, I wish you all the best and I'm sure you're going to succeed. If you enjoyed this episode, let me know down in the comment section what was your main takeaway from Dr. Ufuoma's story. Make sure you subscribe to this channel for more videos like this. If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care everybody. Bye bye.